dear students, today's lecture about algorithm for providing first aid in conditions accompanied by impaired consciousness. Assessment of the situation and the patient condition. At the first glance at a motionless person, what can be suspected and what we can do? Fainting. Make sure there is a pulse on the carotid artery and try to bring it to consciousness. Coma onset. There is no consciousness for more than 4 minutes, but there is always a pulse on the carotid artery. Make sure there is a pulse on the carotid artery and turn over on the stomach. Clinical death. No consciousness and pulse in the carotid artery. No reaction of pupils to light. Make sure there is no pulse on the carotid artery, no reaction of the pupils to light. Hit the chest, start resuscitation. Attempts to resuscitate the victim before signs of biological death appear. Fainting. This is a short-term loss of consciousness due to impaired cerebral circulation. First aid for fainting. Signs: pallor, short-term loss of consciousness. If consciousness does not recover for more than 3 or 5 minutes, call an ambulance. First of all, place the victim on their back. Unbutton the collar of the outer garment and loosen the waistband of the trousers. Raise his legs and provide fresh air. Algorithm for providing first aid for heat or solar stroke. First of all, move the victim to a shade or cool place. If he has a very pale face, apply cold to his head as soon as possible and raise legs. Offer him cold water, better cold sweet tea, still mineral water or ice. If the victim has a feeling of lack of air, it is necessary to provide him with a half-sitting position. Apply cold to the head, chest, abdomen, feet and palms. You can use cold water bottles, moistened towels. Put moistened towel on the face and forehead of the victim. Change them every 2-3 minutes. If the victim has a very red face and convulsive seizures, apply cold to his head as soon as possible, but don't raise his legs. Algorithm of actions for suspected internal bleeding. If after regaining consciousness the victim feels pain in the abdomen or losing consciousness again when trying to get up or sit down, then one should suspect that he has internal bleeding. Live treating. You should ensure that he is lying on his back and raise his legs. Convulsions. Convulsions are non-specific reaction of the nervous system to various endo- or exogenous factors, manifested in the form of rapid, sudden, involuntary contraction of skeletal muscles, often accompanied by impaired consciousness. Signs of an attack: convulsive muscle contraction, twitching of hands and feet, stopping breathing, loss of consciousness, sometimes screaming, head tilting, dilated pupils, glass eyes. It's important to know an attack with respiratory arrest can last for several minutes. If the victim has medicines, then can be used only at his personal request. Other ways, you may face criminal liability for causing harm to health. Some people have seizures several times a day. Track the time on the clock. Don't hold the patient. Turn the patient onto their side. Protect his head from bumps, remove glasses. Unbutton tight clothing. Offer you help after the seizures is over. Signs of foreign body entering the respiratory tract. A person cannot speak and breathe. Sometimes the victim holds onto the throat. The face first turn is red, then blue. A cause appears. If the foreign body is not removed, the person loses consciousness. First aid algorithm. First of all, ask the person to cough. There are two ways to provide first aid to the victim to remove foreign bodies: Buratinos way and Heimlich way. Buratinos way. Move the chair back to the victim's chest. Grab the victim by the waist belt and collar of clothing. Turn the victim over the back of the chair. Pat the victim's back. If this attempt is not successful within 50-20 seconds, you should switch to other methods. Heimlich way. Remember, this is the most effective, but also the most dangerous of all the above. Remember about it, the most effective, but at the same time the most dangerous method should be used only after unsuccessful use of the previous method. Inadmissible. To strike under the diaphragm from children under 3 years old. After each case of hitting the diaphragm, be sure to call an ambulance or consult a doctor. There is a very high probability of rupture of internal organs and life-threatening internal bleeding. Inadmissible. Practice the skills of hitting the diaphragm on each other and especially on faces up to 18 years old. If the victim is conscious, stand behind the victim, wrap your arms around him. The victim's body should be slightly tilted forward. Squeeze one hand into first and place it on the victim's stomach with the thumb side, at the level between the navel and the costal arches, on the epigastric region of the abdomen. Grasp the fist with the palm of your other hand. Quickly make 6 or 10 jerky presses of the epigastric region of the abdomen inwards and upwards to the diaphragm. If the victim is unconscious, lay the victim on their back. Turn his head to the side. Sit astride the victim's hips, facing the head. Place your hands, one on top of the other, on the upper abdomen, epigastric region of the victim. Using your body weight, firmly press down on the victim's abdomen, upwards to the diaphragm. Continue the technique until you recover airway patency or ambulance will not arrive. If the victim is not breathing, start artificial respiration and if no pulse, chest compression. What not to do? Don't use the Heimlich method if the victim coughs heavily. Don't try to grab an object stuck in the victim's throat with your fingers. You can push it even deeper. A missed Heimlich technique is unsafe as it can lead to regurgitation damage to the stomach and liver. Therefore, the push must be performed strictly and the indicated anatomical point. It is not practiced in late pregnancy, in very obese people, and in children under 1 year old. In these cases, chest compression is used, as with closed heart massage and blows between the shoulder blades. Algorithm for helping a patient with diabetes. First of all, turn the victim on the side or stomach. Apply cold to the head. Squeeze lips and pour a teaspoon of liquid honey or thick jam syrup on underlying cheek. Don't, under any circumstances, administer insulin to a diabetic patient in a coma. Attention! The use of cold significantly reduces the rate of development of cerebral edema and makes further treatment easier. Common sign of circulatory arrest. Circulatory arrest, cessation of the mechanical pumping function of the heart. The cessation of blood circulation is accompanied by loss of consciousness, lack of spontaneous breathing. In some rare cases, in the first tenth of a second after a sudden cessation of blood circulation, agonal breathing can be observed, which is not effective breathing in terms of lung ventilation. Lack of pulse in the central arteries. Consciousness check. The victim does not react. Call for help. Turn the victim onto their back and restore airway patency. Open the airways. Head tilt and chin lift technique. First of all, place your palm on the victim's forehead and gently tilt his head back. Keep your thumb and forefinger free to pinch nose. Place the tips of the index and middle finger of the other hand under the victim's chin. Lift his chin to clear the airways. How to quickly remove clothing from chest for cardiopulmonary resuscitation. T-shirt. Any underwear made of thin fabric can be left on, but you need to make sure that there is nothing under it. Shirt. You need to unfasten the bottoms of the neck and chest and release the chest. Jumper or sweater. Lift and slide towards the neck. Tie and waist belt. Be sure to unfasten, remove or loosen. Check consciousness. If the victim does not react, call for help. Open the airways. Check breathing. If it doesn't breathe, call with these numbers and start to do 30 compressions and to breathe. Chest compressions and artificial respiration. The victim does not react and does not breathe. Continue resuscitation until the ambulance will not arrive and will continue resuscitation. The victim will not begin to breathe normally, move and react, and until you can perform resuscitation. Use of artificial respiration devices, face film and face mask. Mouth-to-mouth and mouth-to-nose artificial respiration technique. The airway must be open. Inhale 1 second and not more than 5 seconds for both exhalation. Stable lateral position technique. If the involved is a pregnant woman, always lay her on her left side. This prevents the deterioration of blood flow from the uterus to the heart. If the victim is in a recovery position for more than 30 minutes, turn him over on his other side. This will prevent damage to the nerves in heart. Why you shouldn't leave the victim lying on your back. The tongue descends to the back of the pharynx and stick to it, thereby blocking the access of air to the lungs. The swallowing reflex is suppressed so that the contents of the mouth can flow into the trachea and lungs. The protective cough reflex is suppressed, so vomit, blood, saliva do not come out with a cough, but enter the trachea and lungs. The victim dies by suffocating with this own tongue or by vomiting. If you turn the victim onto his stomach, the tongue will go down, freeing the airways. The contents of the mouth will drain downward. Possible injuries to the victim after a road accident, fall from a height, or terrorist attack. What can you see and what can you do? A lot of blood. If a pool of blood has formed or it has soaked clothing, life-threatening blood loss should be suspected. You need to pinch the bleeding vessel with your hand, apply a hemostatic tourniquet. Unnatural position of the limbs. A reliable sign of bone fracture. It is necessary to give an anesthetic and fix the limb before the arrival of doctors. With traumatic amputation of a limb or its fragment and no sign of life, first try to resuscitate the victim and only then start to stop bleeding and apply bandages. Thanks for your attention.